Welcome back, my people. We are still discussing about diarrhea. We discussed or defined what diarrhea is, the types of diarrhea, and in our previous video we have discussed about the causes of diarrhea and how a person having diarrhea will present with. In this video, we will discuss or compare two things that rhyme, which is dehydration and diarrhea. How are the two related? And how can one affect the other? And before we continue, guys, I always appreciate for your support. Let's continue subscribing and pushing this channel forward so that it might be beneficial to us all as a family. And I have trust in you. The effort I've seen is all because of you that we are where we are today. So let's talk about dehydration and diarrhea. Every one of you knows what dehydration means because we touched it during our discussion about food poisoning. We touched it during our discussion about vomiting. And now, it's here again while we are talking about diarrhea. So, dehydration and diarrhea. Diarrhea can cause you lose fluids quickly and put you at risk of dehydration. Diarrhea can cause you lose fluids quickly and put you at risk of being dehydrated or getting dehydration. If you don't treat diarrhea, it can have severe effects. If you don't manage diarrhea promptly or in the right time or earlier enough, it can have severe effects. So, I know it will be like a repetition, but let's look at the symptoms of dehydration. How will a person having dehydration present with? Number 1, fatigue. Number 2, dry mucous membranes. Number 3, increased heart rate or palpitations. Number 4, headache. Number 5, lightheadedness. Number 6, increased thirst or urge to take water. Number 7, decreased urination or urination rate. Number 8, dry mouth. Let me repeat these signs and symptoms of dehydration. Fatigue, dry mucous membranes, increased heart rate, headache, lightheadedness, increased thirst, decreased urination rate, dry mouth. A point to note: you should see your doctor as soon as possible if you think diarrhea is causing dehydration, because dehydration can have severe complication. For example, kidney damage or kidney failure, and also it can shrink your heart. What do we need to know about dehydration? Oh, what should you know about dehydration? Your body loses water through sweating, urination, and if not replaced, you get dehydrated. You need to know this. Your body loses water through sweating, urination, and if not replaced, you get dehydrated. Another point to note: adults Adults are at risk of dehydration. People who are at a greater risk of dehydration include the following. Number one, athletes. Number two, people who work in the heat. We have older adults and those with chronic conditions. Another point to note, dehydration takes place when your body loses more fluid than you drink. This means the output is more than the intake. That's when you get dehydrated. Common causes of dehydration include, number one, excessive sweating. Number two, vomiting, diarrhea. Those are the common causes of dehydration: excessive sweating, vomiting, and diarrhea. When too much fluid is lost from the body, when you lose too much fluid from your body, your organs, all the body's organs, cells and tissues fail to function normally, and this can cause serious complications like shock. When you lose too much fluid, or when your body loses too much fluid, its organs, all your organs, cells and tissues fail to function normally, and this can cause serious complications, for example, shock. A point to note, dehydration can be mild or it can be severe. You can have mild dehydration or a severe dehydration. I hope you get that very clearly. So, dehydration can be mild or severe. You can treat mild dehydration at home, like applying the home remedies we have been discussing about when we were talking about vomiting. Severe dehydration needs to be treated in a hospital, or needs an hospital admission, or in an emergency care setting, because maybe the dehydration is a lot and you need what we call intravenous fluids. So, what are the risk factors to dehydration? Or what are the people who are more prone to dehydration? We have touched a bit when we talked about the elderly, the athletes. So, what are the risk factors to dehydration? Some people have a higher risk to dehydration, for example. Some people are at a higher risk to dehydration, for example. Who are the people who are at a greater risk to losing fluids or dehydration? Number one, people working outdoors or exposed to excessive amounts of heat. People working outdoors or somewhere where there is no shade, exposed to excessive amount of heat. For example, welders, mechanics, construction workers. Number two, we have older adults. Number three, we have people with chronic conditions, for example, hypertension and diabetes. Number four, infants and young children. Number five, athletes, swimmers, bodybuilders, cyclists, and soccer players. This is because they sweat a lot, making them lose a lot of fluids. Number six, people who reside in a high altitude area. People residing in a high altitude area. So, this marks the end of our second video today, and I hope you are getting all what we are talking about. So, in our next video tomorrow, we will be talking about how does dehydration develop, or how does dehydration come about. So, let's continue keeping the support on, let's continue supporting this channel, and I know this year will be a year of success. Have a good evening.